there, welcome back to Insight. We're here at Steppin' Up right now with Allie, talking about a topic I think many people have chatted about in the past, and one that I think a lot of women deal with. They were talking about infertility. So Allie, what is that for those at home who maybe aren't familiar with it?
Right, so infertility is defined as when someone is trying to get pregnant and it's been about a year and they're unable to, or if they can't carry that pregnancy to full term as well. So one study I found showed that 1 in every 8 couples struggle with this, so it's actually a lot. It's pretty common, so anyone struggling with this should not feel alone. So
absolutely, and I think that's where you come in,
yes,
because you have a pretty awesome job. So what exactly do you do?
So I work mostly with people who are struggling with infertility, and so to do that, basically I'll just kind of palpate the ovaries abdominally, as well as the uterus as well, and then we can kind of check their pelvic alignment and their pelvic floor as well, if that's something they're comfortable with.
So it's infertility physical therapy, is that correct?
Yep, exactly.
Okay, awesome.
Yep.
So what, you mentioned a few things, but what really goes into that when your patients do come in here?
So basically we'll feel around the ovaries abdominally, like I said, and we're just kind of looking for some scar tissue. So if there is that scar tissue, we can kind of break it up a little bit. If there's tight muscles, we can kind of manually stretch them, that sort of a thing. And then we can check the uterus to see if it's anteverted or retroverted, meaning that it's too far forward or too far back. And you can kind of use the sacrum then to help guide it back into place where it's supposed to be. Kind of similarly, you can check the pelvis alignment as well, which is where you can kind of use the patient's own hamstring strength to pull the pelvis back into alignment, which is also pretty cool. And finally, like I said, the pelvic floor, we can assess that as well to just see if it needs strengthened or stretched, and we can kind of give them exercises to go from there.
And Allie, I think oftentimes, a lot of times physical therapy, you can't just go to one appointment and be done. How does it work with you all?
So you'll start out with your first initial appointment where we'll just kind of ask you some questions, just kind of see where you're at, that sort of a thing. And then you'll come back anywhere from 1 to 2 times a week until we reach your pregnancy goals.
Oh, that's so you're really alongside with them that entire way.
Exactly.
Well, and speaking of that, here at Steppin' Up, you seem like a family, which is a really important topic. So what are you guys passionate about here? I think it's just the clients, isn't it?
Right, yeah, exactly, yep. And like you said, just family. So like, my coworkers, I feel like I'm really close to them like a family. My patients, we're really close with them like a family. And finally, like being able to kind of start that family for them. So
yeah, there's something so special about that. And what's the statistic there again?
1 in every 8 couples. Yeah, it's a lot.
So these soon-to-be moms coming in, this isn't normal, it's normal across the board, isn't it?
Right, yeah, exactly. Wow. Yep, definitely.
And I'm sure you remind them of that too, because this is a process that a lot of them don't want to talk about.
Right, yeah, it can be uncomfortable, but it's definitely worth it, for sure.
And so Allie, if there's someone saying, you know what, I'm excited, I'm ready to take this journey and hopefully have a kid of my own someday.
Yes.
What's the best way that they can get a hold of you, or just maybe ask some questions?
Right, and you can just Google Steppin' Up and call us right up if you want to. You can email us, whatever is easiest for them, really.
And if they have questions that, maybe they're not ready to take this first step, they just have some questions, it's okay to call you guys.
Absolutely, yeah, anytime,
My
anytime.
gosh, that's so encouraging, because once again, there's so many women going through this, or maybe are going to go through it someday.
Yeah.
So just to know a program like this exists is so encouraging.
Yes.
So thanks so much for being with us today.
Thank you.
It's so encouraging, and once again, I'm so passionate about this topic, so I love that. So if you're looking for more information about Steppin' Up or the programs that Allie just talked about, all of that's going to be on your screen right now.